Life is all about the gray area undefined. Life is filled with parallels. You can have your cake and eat it too. You can choose to live your life out loud, or you can choose the in-between or the middle of the road. Inside the gray area, that's where life happens. I'm Leanne O'Brien, Chief Marketing Officer for McGregor. Welcome to Inside the Gray Area, sponsored by McGregor. We're here today with Dr. Cynthia Balina, who is the Medical Director for McGregor PACE, the program of all-inclusive care for the elderly. McGregor PACE for more than a decade has been the only PACE program in the state of Ohio. We've been in Cuyahoga County and have now moved into Lorain County services as well. We look forward to other partners joining us throughout the remainder of 2024 and into next year to cover 7 counties. So the expansion of this program is vital to those who wish to remain at home in the community. We all know that a lot of people prefer to remain in their homes as opposed to moving to a residential care community. Here we are. Welcome, Dr. Balina. Thank you for joining us.
Thank you.
So tell us, what is PACE?
So PACE is a program here run by McGregor. PACE stands for Program of All-Inclusive Care for the Elderly. Our goal is to bring services to seniors, as you mentioned. Our current model, as people age and require help with their activities of daily living, taking care of themselves, our current model is to bring the person to the care, right? We admit them to the nursing home. But PACE approaches this completely differently. We want to bring the services to the person where they live in the community, have them remain in their home, and bring all those good services to them so they can remain and age in their home.
Another question that a lot of people ask us is, how do they join? What's the eligibility criteria?
Sure. So there are specific eligibility criteria. The person needs to be 55 years of age or older, need intermediate level of care, or we define their disability, needing help with, again, taking care of themselves, perhaps not being able to be left alone because of dementia. So we define the amount of care they need, and they have to meet certain criteria there. And they have to live in the service community, which is what you alluded to, which had been Cuyahoga County for the longest time, but now we have spread to Lorain County and opened a PACE center there.
And I guess we look forward to next year opening in Summit County.
Yes, yes.
Where are some of the other areas that PACE centers are going to be opening? Maybe not through McGregor, but some of our other partners.
Yes, this was a really big deal in our community. As you said earlier, PACE was owned and operated and the only PACE program in Ohio for many years. And just last year, after a lot of work by McGregor and many other community partners, the state of Ohio granted this expansion. And I'll read you off the list of counties. So McGregor was awarded Lorain County and Summit County, but there also expansion to Franklin County, Hamilton County, Lucas County, Montgomery County, and then there's a rural PACE model that's bringing PACE care to Ashtabula, Mahoning, and Trumbull counties. This is a huge leap forward for service to folks that need it in Ohio. Our goal would be to be similar to other states in the Midwest that have PACE programs in just about every county in the state.
That's going to be fantastic.
Yeah.
We really look forward to that. Let's talk about some of the services that PACE brings to the participant in their home, which I'm sure gives peace of mind to the family members as well.
Right. So the really cool thing about PACE is that we make an individual plan for each individual person. Each person is required to be evaluated by the team, the interdisciplinary team, and it's the heart of PACE. It's how we make all the decisions, how we help the participant make their plan of care. And this is 11 specialists that all sit at the same table and talk about the same person with the same goal in mind. So we usually start with the medical people, but I'm going to end with the medical people because we are just a part of the team and not the reason for the team. So let's start off with the biggest need for people in this position is usually home care. So we provide the home care. We arrange it. We help you make a plan for what the person needs, and we arrange it and we pay for it. So home care. How about transportation? Doctors can have all the good intentions they need, but if the person can't get to the test and they can't get to the office, it's all for nothing.
That's huge.
How about food? Not just delivering meals, but offering a choice of meals, home delivered meals for sure. When people are at our day centers, we provide them breakfast and lunch, but along with that, dietary services. So many people have medical problems that would improve with a change in their diet, and every person also has a dietitian that can help them learn about their medical problems and how to eat more healthily. Social work support. So every single person has a social worker that just helps with a variety of things. It may be connecting them to other community resources, helping them with housing, and even for some participants, counseling and family counseling. How about exercise? Each center has a physical therapist, occupational therapist, speech therapist that not only treats a problem, right? We might be referred to the therapist if we have back pain or we just had a knee replacement.
Right.
But at PACE, we believe people need exercise forever. So once you complete your acute therapy program, then we keep you engaged with what we call wellness program. We think that in order to keep you healthy and at home in the community, we also need to focus on your mobility, which means you need to come in and you need to exercise with us as many times a week as you can tolerate. So that's therapy. I'm going to mention the day center next.
Yeah.
So while we provide services at the person's home, sometimes the problem is loneliness and isolation. So we solve that problem by our PACE Day Center. And our PACE Day Center is really the center, right? The heart of the services that we provide. So a person would be picked up at home by our transportation department, brought to the center, and it could be for a variety of things. Maybe that participant just wants to attend the senior center and go to see a Guardians game and have lunch and talk with other people. Perhaps that participant has severe dementia and needs to be in a place that is able to provide more care for them, being able to take them to the bathroom and make sure that they're safe during the day. But it's not just a day center or an adult care center. You walk down the hall to the therapy gym where you get exercise, as I just mentioned, and then you can turn the corner to our clinic, and that will lead me to the last part of the services, of course, which is the medical care. So we provide primary medical care to every one of our participants. They're able to keep their current physician in the community should they choose. That's no problem. We can absolutely coordinate with them. However, if they're at their center or at the center or at home and they don't feel well, we have daily ability to see them either at the center or at home, coordinate their hospital care. In addition to that, we do a tremendous amount of preventative care and management of their chronic illnesses. So this is doctor, nurse practitioner, registered nurses, and that's the medical care that is also provided at our PACE Center, but also in the homes. We go where the person is. If they're at home and they need care, we do home visits. If they're in the nursing home recovering from an illness, we go there and take care of them as well.
It's almost the most comprehensive care that I can think of that even exists today. It's, the one-on-one.
Yeah, it's a brilliant model. It was created in San Francisco about 50 years ago now, and is spread throughout the country, and it works. It aligns mission with money, and so we're able to invest in prevention to try to address advanced care planning, making sure that the procedures we ask you to do are in line with your goals of care. And it also allows us to invest in prevention when we need to. Sending a home health aide costs money, but allowing you to remain in your home and saving you the emotional and traumatic burden sometimes of being in a nursing home is a tremendous investment in someone's health.
Absolutely. And you mentioned transportation. I think it's important to note that it literally is door to door. The bus doesn't just pull up out front and toot the horn and wait for the participant, as we call them, to come out. Our drivers will actually go to the door, into the house, and help that individual out the door and onto the bus.
Right. Our drivers are taking folks to many places, not just to the day center. Perhaps you have an appointment with a cardiologist at a major medical center. They're taking you there and making sure you get to the office. They're taking people to dialysis. We have people who are going to receive addiction support at various community centers, and they're taking them for those group therapies as well. Wherever you need to go that contributes to your wellness, our drivers will help you get there.
That's fantastic. Yeah,
it's a big hole in a lot of communities that just don't have a lot of public transportation.
it is. And for the adult children who may have a parent living with them, it also gives them great peace of mind knowing that whether they're working from home remotely, whether they have to go into the office, that still those services continue despite their presence or maybe being in a work environment.
Absolutely. We understand and we track caregiver stress over the course of a person's enrollment with us. And, you know, specifically I tell families when I meet them that we understand how hard it can be to take care of another person, and that we don't require, for example, a family member to be present with them in clinic. We know who's unable to make their own decisions, so we will see the person, draw labs, x-rays, whatever we need to do, but then we know that we need to call the daughter or son or family member, and that saves them a tremendous amount of time. You know, when I take my mom to the doctor, she's not in PACE, and it takes me a half day to get there, to get her to the right place and wait for the doctor.
Sure.
This, I really just need a 5-minute phone call with you to review the plan of care. I'm going to deliver the medications to your door, and everybody can keep moving.
Let's share with our viewers, you know, the hours of operation, how the health centers operate.
Sure. So our PACE centers are open from 8 a.m. to 5 p.m. Monday through Friday. But when the center isn't open, there is still care available for you at home. So when the centers close, holidays, weekend, there are several people on call and ready to help you if you need help, because not all emergencies happen during daytime hours. So you can get a hold of, for example, a medical provider to talk through a problem, to decide whether or not you need to go to the emergency room. Available even at 2 in the morning, we'll answer the phone. There's also administrator on call. Yep. Say your home health aide, you have a trouble with your home health aide and you need to work through that problem. Then you call our administrator on call who helps work through that problem. We also have extra home health aides on call. Should you need a problem and need extra help over the weekend, we can send extra people. So we're available for you when we want to help you when the center is open. Most of the activity happens, but also off hours when things happen as well.
We're very robust in the community when it comes to some of the health fairs, the health and wellness events, and the programs that our team offers, you know, in every community throughout Northeast Ohio. So if you're wondering where we are and how to find us, certainly you'll find us at one of those events. Is there anything else that you think our audience should know?
I think this is the wave of the future. People do not want to live in nursing homes, and we need an alternate plan to them. That being said, there is a place for nursing home for some people, but for the majority of people who are aging, their quality of life will be much enhanced if we can just take care of them at home. People can do this. They can take care of their family members, but they need a little help, and that's why you call PACE.
Well, thank you. Thank you for sharing the story of McGregor PACE. We look forward to seeing you during our next podcast. Thank you.
Thank you.
Thank you for joining Inside the Gray Area. We're here to answer all your questions and share some interesting insights. I'm Leanne O'Brien. We look forward to seeing you next time, and be sure to follow us on social media and our YouTube channel.